All right, guys, today we're going to talk about trach care, trach suctioning, just some standard points about trach. I'm going to do my best to show you as much as I can in this video. I'll try not to move my camera a whole lot so it's not shaky. But we're going to start with trach suctioning and then go to trach care. The whole purpose behind that is that when you suction someone via their trach, they're going to cough and a whole bunch of secretions are going to come out of there. So you don't want to clean it and make it all nice and then suction them and have them cough. Obviously, sometimes you don't have control over when your patient needs to be suctioned, but if you're going to do both things together, you want to suction and then do trach care. And in your comp, there's going to be two comp cards. They're going to be very similar with just some minor differences. One of the things you're going to need to take note of is, does the patient need to be urgently suctioned, or can you do an assessment on your patient first, as well as do they have a disposable inner cannula where it tells you to just put a new sterile inner cannula back into your trach, or do you take it out and wash it and put it back? And I'll show you a little bit more in post what I'm talking about. So here's a typical trach that is a cuffed trach. So you actually, when they're put into your patient, they put some air through here, and this blows up like a balloon, and that's what holds it into your patient. And they have a cannula that comes out of the middle. Now, all we have really here are these disposable inner cannulas. So in the hospital, a cannula that's not disposable will look a little bit different, but be similar. Here, we're going to pretend, in the case where it tells you to remove it, wash it, and put it back in, that this is a non-disposable inner cannula. In the other cases, it will tell you just put a new sterile inner cannula in. And so they go in like this. You actually can start, if I show you from this direction, you probably can see better. You want to start at like 3 o'clock or 9 o'clock and push this in. You can't often go from just down below. You have to kind of start from over on the side. And these inner cannulas, especially when they're dry, don't go in super great. And it kind of moves around towards the front as you go in. And then most importantly, they're locked in. So here you can push and you hear that click, some twist on and lock. We also have uncuffed trachs that can be plastic or metal, where they don't have a cuff on them and they just sit. So importantly, when we are doing anything with a trach, we want to make sure that it's on your patient securely, because they could cough this out or become dislodged, and your patient doesn't have a good airway, which of course we know is very important. So we are going to start with just doing some trach suctioning for our patient here. I would make sure that you have your step-by-step skill sheets with you anytime you're practicing. I'm going to just go through this skill sheet, tell you, of course, a little bit more about some of the details as we move along. When you get ready to do your trach suctioning, you're going to need a suction kit. It says suction catheter kit right on it. You're going to need a mask, and you're going to need sterile water or sterile saline. As well as you're going to need to make sure on the wall you have oxygen and suction set up. Your comp card is going to tell you what type of oxygen your patient is on. And there'll be a little card here on the wall that will tell you how to adjust it, because when they're on a trach collar, which is what this apparatus is, there's a special piece that comes off of the oxygen that you can dial. So there's this blue dial up here. When you get into the lab, take a look at it, and you can dial that to whatever oxygen you want. If your patient's on 40%, you put it on 40%. And up here, this little card is going to tell you 40% means you have to put the oxygen on 4 liters to achieve that actual 40% through this canister. Okay, so I'm going to turn it on. I'm not going to turn it on too loud because it can get a little bit loud, but just so that we can know that that is on. Make sure that your suction setup is here as well, and you can turn it to continuous or regular. You do not want it on intermittent suctioning. Okay? So once you make sure you have all of the pieces at the bedside, you're going to come in. Of course, you're going to perform hand hygiene. I'm going to wash my hands. When I come in, I am going to identify my patient. Mrs. Smith, can you tell me your name and date of birth? And explain the procedure as we do with anything else. Make sure that the curtain is closed for privacy. Even if the patient doesn't seem to be awake or cognizant, you're always going to explain to them what you're doing, because you never know if they can hear you and understand you, even if they're not fully awake and communicating with you. So you want to put the bed up. I've already done that to a nice, comfortable working height. You want to make sure you have a trash can nearby. You can put this side rail down so that you have a little bit better ability. This trach collar should be snapped on all the way when you start, and that will be important because you'll want to unsnap it on one side. So make sure you have all your supplies close by. If you're right-handed, you should really be on the right-hand side of the bed and have your table turned the other way and be working, but I can't film and do that, so I'm going to do it this way. Then you want to make sure you can get like a towel or a waterproof pad to put across the patient's chest. Not, if you don't do that, you certainly aren't going to fail the comp, but it will help to keep your patient's gown in real practice clean and dry from all these secretions that might come out. Then you're going to want to turn your suction on, which we already put it on continuous, and you want it to be for an adult between 100 and 150, which is really in this like high medium range for a wall unit. And how you will determine that on these units in the lab is you will have to occlude the end of it or kink the tubing to actually get it to show you how much suction it's on. In real practice, that will tell you that right out of the gate, but that's just a particularity to the lab. You never want to take an ungloved finger and put it on the end of this suction tubing. It's gross, it's contaminated, there's all sorts of respiratory secretions there. So the next thing that you want to do is put on a clean pair of gloves and make sure that that suction is working. So you can put your finger right over the end of it, and then you actually can watch the gauge on the wall go up and tell you how much suction is going to be applied when you actually put this down into your patient. You, of course, don't want that suction to be too high, or the patient's we could damage the lung tissue with the catheter. Because this trach suctioning, the catheter is going to go through the trach down into the respiratory system to suck out secretions. Okay? We want to then put this in a convenient place for us because we are going to need it once we get our sterile field set up. Trach suctioning is a sterile procedure, so it will be important that we don't contaminate our patient's respiratory system. At this point, you can also make sure that your oxygen's up. You can unsnap your trach collar, so you want to turn your oxygen up to 100 and adjust both the ring around it here, the blue ring, and the gauge on the wall to make sure that your patient's getting 100% oxygen. Because we're going to suction them, we're actually going to pull oxygen out of their system for a minute, as well as they're going to cough. It's going to take some time for them to recover. Once you take off your sterile gloves, the most ideal thing to do is wash your hands again. So you don't have anything sterile set up on your field right now. There isn't any reason you can't walk over to the wall, get some alcohol sanitizer, and wash those hands. Best practice is wash, glove, wash. So we can try to apply that as much as we can without contaminating if we have sterile objects opened. Now we're going to go ahead and get started with setting up our sterile field. This package, when you open it, there's going to be another package inside of it. You don't need to really worry about keeping that sterile. You can see that I'm moving my garbage can. Of course, if you did that in practice, or you do that in your comp, you need to wash your hands after you touch that can. So if it's not in the correct place and you have to move it like that, you can always use your feet to give you a hand as well. Once you open this sterile package, right here underneath one of the little edges of the glove, so it's not really in with the gloves, is going to be this little box. And it's going to be positioned so that you can grab a hold of the end. This end does not have much of the plastic on it. What you'll do is put your fingers like this and pop it open. You might need to help from the other side a little bit. This part has a plastic wrap on it. That's where you're going to put sterile solution. We don't have gloves on yet because we need to still put sterile solution in that. So you're going to pop that box open and set it down. You don't want to contaminate that. So you're just handling it from the underneath side. Then, of course, we are going to put some sterile water, some sterile saline in it. Remembering this should be date, timed, and initial. It's only good for 24 hours. If it doesn't, if it's already been opened and used, you should lip it to wash away any microorganisms from the edge. You can then go ahead and pour that into this little box. Slowly and carefully, not to spill or contaminate on the rest of your sterile field. Then we're going to go ahead and put on our mask. And this needs to stay on the entire time. It's not going to be easy for me to keep this on, so I'm just going to keep it on for as long as I can and then take it off because I can't talk to you for 20 minutes on end without fogging up. Once we have that done, we have this on, we're going to go ahead and open our sterile gloves. And once you open this, inside you're going to see sterile gloves, and you have to be cautious. If you hit your canister here and contaminate this, that's not going to be good. I'm going to take this off. Just remember, this must stay on the whole time you're providing trach care and suctioning. There is a huge risk of contamination of the eyes and the respiratory tract when you're doing trach care and suctioning. So once you open your sterile package, there is going to be a couple of things here. There's going to be some sterile gloves in there, and there's going to be a sterile package with your suction catheter. I'm just going to pick it up and show you what it looks like. That's on one side, and 2 pairs of sterile gloves stacked on top of each other is on the other side. When you open this, you don't want to touch anything except for your sterile gloves. So you're going to reach for the cuffed side of your sterile gloves. Remember, you can touch the cuffs. You might have to pull them apart gently by touching the cuffs. So once you have the cuff of the first one, go ahead and get it on. You need to work with these sterile gloves. If your hands don't fit, these are pretty big. If they don't fit, then you can get another pair. Otherwise, you need to learn to work through the sterile gloves that are in the package. Now I'm putting my hand up underneath the cuff of that other glove, pulling it up way away from my sterile field so I don't contaminate, and working to get my hand in there. I had it backwards, that's okay. I'm just going to flip it around and pull up on my cuff. Now I'm sterile, right? I can manage the rest of this inside of here if I want to, when I need to, which I do. So I'm going to carefully remove my sterile suction catheter. This is what has to stay sterile. As soon as we start to suction a patient, one hand is going to be sterile and one hand is going to be dirty, because we have to manage that suction tubing over there that's dirty. So we're going to go ahead and wrap it around our hand just so I maintain control and it's not flopping all over the place, contaminating. So I have good control, and I'm just kind of wrapping it around my hand to maintain good control. And then I have just the end of it here like this, okay? I am going to then, I'm usually right-handed, so I should go from the other side. It would be more comfortable for me, but I'm pretty experienced, so I can do it from both sides. I'm going to use my dirty hand now to pick up my suction tubing. I am going to connect those pieces like this as to not contaminate this gloved hand. If it slips off and touches that piece contaminated, I need to start over. I can't adjust anything once I've touched this. I can't do anything to this tubing or it's contaminated. I'm going to gently push this on and twist. You want to be somewhat forceful here because you want to be suctioning your patient and this comes apart. Okay? Once you do that, you're going to make sure that your system is working. Okay? My system doesn't appear to be working, but that's okay. Doing the best I can here. I'm going to go and suck up. Oh, it is working. Perfect. So not only am I lubricating the tip, but I'm also kind of clearing the catheter to make sure that it's working so I don't get all the way down inside my patient's trach and it not work. And I'm wrapping it back up in my hand so I have good control over it and I'm keeping it nice and clean. I still also have to remove the oxygen from my patient. So remember back at the beginning how we unsnapped that trach collar. Now it's unsnapped and it's easy for me to move to the side so that I now have good access to that trach. Okay? Now what I'm going to do is go back and I'm actually ready for my suctioning. I'm going to be careful that my suction tubing itself doesn't actually touch my patient. So I've got it somewhat elongated like this, and I'm going to go in slowly and work my hand in. I'm going to go down till I kind of hit the bifurcation or my patient starts to cough. As soon as they start to cough, I'm going to apply pressure on this valve here. That's what actually applies the suction. And while I'm doing that, I'm twisting the catheter back and forth, applying intermittent suctioning and working my catheter back out. Okay, so I'm going like this, into the trach, thumb off, into the trach slowly, and meet resistance, or my patient starts to cough. I apply pressure, and I'm twisting in my hands gently the catheter, as well as applying intermittent suction with my hand. That's what I'm doing, and I'm working my hand up the catheter as it comes out so it doesn't fall on the patient's chest or move around. Okay, once I have it out, I'm going to wrap the catheter back up in my sterile hand. I'm going to put the oxygen back on the patient so that they can recover during this time they're coughing. You know, we just sucked the air out of them and we irritated their respiratory tract. Make sure you're not down there longer than 10 or 15 seconds because the whole time you're suctioning, your patient is not getting oxygen. Okay? So then we're going to come back over here. We're going to flush our line to make sure that it's not occluded with all those junky secretions that we just got out of there. Make sure it looks nice, it's working well. I'm giving my patient 30 seconds to a minute to breathe and recover. And if additional suction is needed, I'm going to go back and suction them again. Typically, you need to suction a couple times if they have a bunch of secretions. You can only suction for 3 passes per suctioning episode. Okay? I'm going to show you one more time how I'm going to do this. I'm going to move the oxygen off of my patient. I'm going to unwrap the catheter from my hand, and I'm going to take my thumb off the valve. I'm going to carefully put it into the trach and feed it down into my patient, not to contaminate the catheter or this sterile hand. When I meet resistance or my patient starts coughing, I'm going to occlude intermittently, twisting the catheter slowly as I'm pulling it out, applying suction. I'm going to wrap it back up in my hand. I'm going to apply oxygen back to my patient and allow them to recover. Once I'm done, 1, 2, or 3 attempts at it, when my patient seems better, their symptoms appear better, then you can see I'm having trouble getting this trach to stay on this trach collar to stay on this patient. You want to make sure it's in close proximity so that they're getting that air. You're not snapping it back up, but you're at least setting it there so they can get some air. I can at this point actually also suction the mouth with this. Here it's good, good practice to get any secretions they might have in the back of their throat out. Once I suction the mouth, though, I can't go back in the trach, or of course that's contaminating the whole respiratory system. Once I'm done with the trach suctioning and into the mouth, I can disconnect my suction catheter from my tubing. Go ahead and set my tubing down. And then I can go ahead and take my suction catheter here and actually pull my gloves off right down. If I'm also going to do trach care next, I may at this time, before I take these gloves off, I may pull this dressing that's underneath the trach off. That'll be the start of trach care. If you forget to do it now, that's totally fine. You can do it at the beginning of trach care. Okay? So I can then pull my glove right down over this suction catheter, and the whole suction catheter is there. I'm going to wrap that one up in this hand and do the same, and I have a nice little contained kind of package to deal with. What I want to make sure then I do is, of course, put my side rails back up. I can turn my suction gauge back off, and I need to put my patient's oxygen back down to what it was. If I'm going right into trach care, I can leave it at 100%, but when you're done, whether you're just going into suction the patient or you're doing both, it has to go back to what their baseline was before. One other thing that I want to make sure that I know, I don't think I did at the beginning, is that it's important before you go into suction your patient that you assess them. If you walk in to see your patient and they are coughing and gagging and their oxygen saturation is low and they're cyanotic, am I going to spend several minutes listening to lung sounds, counting respiratory rate, looking at respiratory effort? No, I'm going to jump right in and suction their trach to make sure they have an open airway. If I go in, they just have a few secretions, they don't seem to be in any respiratory distress, then ideally, I'm going to assess my patient first, I'm going to do trach suctioning, and then when I'm done, I am going to suction them, or I'm going to listen to their lung sounds and assess them again, so I can see, when I did my intervention, did it have the desired effect on the patient? Okay? Of course, when you're all done with this, you also can offer some oral hygiene, meaning brushing the teeth, using some mouthwash, using some swabs to make sure that that environment, not only did we suction it out with that catheter, but it's clean. Aspirating oral secretions is a huge indicator of hospital-acquired pneumonia, especially when patients have trachs and vents and things like that. So when I'm all done, I'm going to then wash my hands. So I'm going to do hand hygiene. I'm going to show you in the next video then how to do trach care itself.